Dear spectators, a warm welcome from Zurich for this time. Today's topic, an ancient healing knowledge. Dao Yoga in connection with massage and paranormal surgery. Furthermore, quite amazing medical results beyond academic medicine recommendations. We will come to this later. A warm welcome. Dear Nikolai, thank you for being here with you in your treatment practice. The issue of Dao Yoga, how did that start with you? How did it evolve? Let's say, as a practice you use with your clients, with your patients. First, I watched it at my mother's, about 15 years ago. But at that time, I didn't learn it yet. I was about 7 or 8 years old, and then... But you saw and witnessed. I've seen that before, and when I was about 16, I started to be interested in it and learned that. With 16, I learned all 5 exercises of Dao Yoga and paranormal surgery as well. And the first time I applied it on my friend to see if it works or not. He suffered from severe eye disorders. It worked very well. I was greatly mesmerized by this method. He also applied it all, Dao Yoga, paranormal surgery, and also self-treatment exercises. When it comes to Dao Yoga, the noun yoga could give the impression that you are dealing with exercises that are more physically oriented. It's a completely different yoga. It's a spiritual yoga. You work with it, learning to control your energy, to feel it by various exercises. It's not a yoga by moving. That's why anyone can learn it, without exception. Even sitting in a wheelchair, you can still learn it. You don't have to be able to perform special moves or positions. You say, charging up energy, controlling energy. You've got a whole series of exercises where you, as it is called, charge up different cauldrons, downright different parts, whipping them energetically into shape. Well, it's about bringing your energy into balance. For example, you learn how to gather life energy, how to gather creative energy, how to gather divine energy. Each of this energy has its own effect. For example, against age-related diseases, karmic diseases like multiple sclerosis, which are not congenital, for example, and each exercise also has its own effect. That's exciting. Well, with this knowledge of Dao Yoga, so different from, it's not academic medicine anyway, but so different what we are usually told. You may still have karmic burdens from other incarnations. For example, yes, it's helpful here too. And moreover, Dao Yoga makes you smarter, gives you a better understanding in a lot of other things. For instance, you get a better clue of art. Some people gaze at a piece of art and saying, "What kind of scribbling is that?" And by exercising Dao Yoga, understanding evolves. Memory and brain also evolve strongly. If you practice Dao Yoga, is it something that you, let's say, do for 14 days and then stop again? Or how do you have to deal with the subject of Dao Yoga in a meaningful way? If someone decides to take up Dao Yoga, he has to integrate Dao Yoga into his life, because you have to do it every day, like eating, drinking, breathing. So you have to practice at least once a day. It has to be built simply into your daily cycle. and be part of it as a matter of course. Like brushing your teeth, you do Dao Yoga. Where does Dao Yoga originally come from? Is it all old knowledge? Or how do we have to fancy it? Dao Yoga is very old. It originates from 2000 years ago in Tibet. Tibetan monks never treat themselves with herbs or medicine, nor with pills. Their self-treatment consists in Dao Yoga. Very few people know this method, and these are only the supreme monks in Tibet. And we are lucky to get to know that. So I achieve health improvements solely with Dao Yoga? Yes, many people get rid of their disorders just by applying nothing but Dao Yoga. They completely get rid of whole ailments. If someone can't accomplish it on its own, he may continue the treatment at my place using paranormal surgery. In order to learn this Dao Yoga for yourself, are there seminars that you can attend? Do I have to read books or how do I do it? At the moment, it's only possible by seminars. I do seminars in Switzerland and in Germany. You are teaching these seminars personally. Yes, I offer seminars in Switzerland and also in Germany, and I teach all exercises in these seminars. How much time does it take? The seminar lasts 2 days, and it's not only learning exercises. Also treatments are implemented. During the seminar, a lot of work is done with energy, and after the first day, a lot of people are tired, because a lot of energy work was done. But the very next day, people feel much better. So you have a kind of basic course during the first 2 days, and then you can do another advanced course. Or is everything already learned in one course in this 2-day seminar? A lot is learned during the first seminar. There's also an advanced seminar where you can repeat. This is designed for advanced students who talk about their experiences they have made. They may have mistakes worming their way in. For example, they are not doing things properly and you can correct it. There are also some additional exercises to learn. So it is definitely a good idea to do both seminars after a space of time in between, in order to have the opportunity to correct mistakes and eventually exchange experiences. Exactly. I would recommend that 3 or 4 months after the first seminar or even later. It doesn't really matter, but the earliest after 3 or 4 months, when you already know all the exercises and can practice them. You say solely practicing Dao Yoga gives you health effects and results. Are there specific exercises for cardiovascular problems, for migraine, for diabetes, for multiple sclerosis? Or is this an overall energy recharging seminar and system where the body is to know exactly what it needs? Well, you don't have to treat anything extremely with Dao Yoga, but during the seminar I also teach self-treatment exercises that specifically address a certain problem, for example, a herniated disc or multiple sclerosis, and how you can treat that by yourself. You just addressed MS, herniated disc, a whole amount of health problems. Is there a limit somewhere to say, nope, Dao Yoga doesn't work there? Or is Dao Yoga almost all-encompassing? Well, Dao Yoga is all-encompassing, but only if the person really wants it. That is, of course, the prerequisite, and disciplined practice every day. You combine, and this is your speciality, Dao Yoga, we will get to the paranormal surgery soon, also with a Tibetan healing massage. We are back in Tibet. What is so special about it? Well, the Tibetan massage is different from other massages. That is deep muscle massage, very deep muscle massage. It requires different hand movements, and I also work with a person's energy during the massage. Blockages, for example, are dissolved, and not only tensions, but blockades, energetic blockades, from which the problem originates. I sense these blockages, and then I dissolve them. Or when you talk about deep muscle massage, is it painful? If you really get into the muscle? Or how do the people feel about it? Well, mostly painful. If you have tensions, it's painful, yes. But that's bearable, and after that the tension is released very quickly. One feels very easy after it. Everybody says so, without exception. Everyone has said so far, I now feel very, very light, and pain that comes from tension is dissolved, often, already by the first massage. Blockages, which of course can also be felt in the musculature, or which can be located in the musculature, may also have a not really physical. They may have a mental, perhaps have a karmic background. Are such things also treated in such a massage? If this is a blockade that doesn't come from me sitting at the computer every day, doing my mails, but from other origins? Yes, they also get treated. Many people just come with stress symptoms, for example. They have a lot of stress and therefore have tensions. But energetic blockages also cause tensions. The body shows us in his way. Even if you have organ problems, for example, tensions can occur in your back. For example, theoretically, having liver problems, you get tensions in the same place, but that doesn't mean that they are muscular disorders. And with the massage, you approach these problems exactly, from the organs to the spiritual level, also the energetic level, and also to the physical level. The origin has already been made clear with Tibetan massage, but is this also something that has a very old tradition, or is it something newer? This is also a very old massage, just like Dao Yoga 2000 years ago. And the roots are also, I say, the monk culture and the monks who have used it and still use it today? Yes, it all comes from the past. This is the second component. The third is paranormal surgery. Could you tell us about it? This is a method of surgical operation without a knife, without a scalpel. I do it just with my bare hands. It's an operation without bleeding. There is no blood, and I do not take out any organs as other methods do. No blood, no knives, and during the operation I work with energy, and to a great extent with the subconscious mind. Because in the subconscious the information of diseased tissue is memorized, or of unsound organs, or maybe of arthrosis. If the joint is diseased, I exchange that memory by new and positive informations. For example, if I treat arthrosis in a shoulder joint, then I replace this information of a diseased shoulder with pain or hampered mobility with a new and positive information that this shoulder is healthy and sound, no arthrosis there. And the joint regenerates. You get, so to speak, a new joint. An X-ray of a worn joint with an arthrosis shows, after some time, well, let's say approximately after 6 months up to 1 year, that the joint is healthy again. So we have to imagine that you reprogram a human being via the subconscious, like a computer from, I have the health problem, I have a disease here, I have a disease there. It is reprogrammed to, the tissue is healthy, pain is gone, some organ wear or joint wear is gone, like a reprogramming. Well, you can imagine it that way, but it's through consciousness, through the connection between consciousness and subconscious. That's why you can easily bring this information in. The person is fully conscious. Many people ask whether it's hypnosis or something else. This is not hypnosis. The person is fully conscious, put simply, with closed eyes. But with full consciousness, one feels everything. We'll take a look at how you do a treatment. What is the health problem with the patient? What are you going to do? What do you have to do? What did he come to you for? Well, he had problems with the whole spine. So, in the lumbar spine, the thoracic spine, and the cervical spine. He already had pain in his lumbar spine when he bent down and while walking. For example, he couldn't walk for a long time. And he told me that he had very strong troubles in the cervical spine, in the shoulder joint and right arm. And slipped discs were also there. And what we see now is a kind of, how shall I say, classical treatment in the field of paranormal surgery. Yes. I deepen the incision even more. Now I separate the tissue. And I deepen the cut even more. I open the lumbar spine, the thoracic spine, and the cervical spine. I separate the tissue. So, now I treat the lumbar spine. I remove the diseased tissue from the lumbar spine and take everything out. I remove the diseased tissue from the lumbar spine and take everything out, until the feeling light and empty arises in the lumbar spine. So, what do you feel in the lumbar spine? It's good. It's light. It's light. Okay. Now I treat the thoracic spine. I remove the diseased tissue from the thoracic spine and take everything out. I remove the diseased tissue from the thoracic spine and take everything out. I remove the diseased tissue from the thoracic spine and remove everything until the feeling light and empty arises in the thoracic spine. What do you feel in the thoracic spine? Left and in the middle. Still a little bit. Okay. I remove the diseased tissue from the thoracic spine and take everything out. I remove the diseased tissue from the thoracic spine and take everything out, until the feeling light and empty arises in the thoracic spine. So, what do you feel now in the thoracic spine? All right. Okay, now I treat the cervical spine. I remove the diseased tissue from the cervical spine and take everything out. I remove the diseased tissue from the cervical spine and take everything out. I remove the diseased tissue from the cervical spine and remove everything until the feeling in the cervical spine is light and empty. So, what do you feel in the cervical spine? That's good, light and empty. Okay, good. So now I close the incision. Now I stitch up the incision. Now I heal the cut. Now I do energy treatment. As soon as you feel warmth under my hands, let me know. It's good. Now try to feel that this warmth fills the whole lumbar spine, the whole thoracic spine, and the whole cervical spine. Now I do energy treatment until the feeling light and empty arises in the lumbar spine, the thoracic spine, and the cervical spine. No feeling of heaviness, but a good light feeling. As soon as you feel this, tell me.
Der Patient hat insbesondere im
The patient has had problems, especially in the back and spine area, and has come to you for treatment. And then you did a normal cycle with him. How many treatments are this? Well, I did 10 treatments. Why 10 treatments? Not 8, not 9? If you do 9, you don't get a result. You have to do 10, because only then the information is stored. It is scientifically proven too that by then the information is stored and goes on working automatically. Furthermore, it works the whole life long. So this reprogramming is something that you can't flip like a switch. It's much rather a process until the consciousness or the subconscious realizes that by now everything is fine again. Yes, exactly. This is a process of 10 times. Now we'll take another look at it. I had a little conversation with Herbert Schröpfner, and he tells us tells me his suffering and the problems he had. And where he was very close to decide whether or not he would have to undergo a classical operation.
Wo ja ganz dicht an der Frage und an der Situation stand, muss unter das Messer oder muss nicht unter das Messer?
Did you start with Dao Yoga or with paranormal surgery? How did that start with you? So, I first registered for the Dao Yoga course I attended with you in Rorschacher Berg. That was the beginning, and especially it was then, that was Monday, Tuesday, that was then, directly on Wednesday I had drove to Baden-Baden. That all went very fast, and on Wednesday evening I already received the first treatment with paranormal surgery. And you've been doing both things in parallel ever since, or rather you pulled Dao Yoga through. Yes, I've been practicing that every day since then, with 1 or 2 exceptions. I attended the second course in October then. I didn't adopt too much of that second seminar because I think that the first exercise of the... Right, that's quite a bit. But I do that every day, always before breakfast. Good, very nice. You said after the first course you immediately received the first treatment? Would you just like to say a word about what your health problem is that needed treatment? Yes, I'd like to. I started in December 2012. I had difficulties walking, especially climbing stairs. Pain. Then I went to the doctor and I got my first ESI. It should have lasted 6 months. End of January or beginning of February, a second ESI was necessary. And it helped for about 1 month. During that time I was still working, taking more and more painkillers. So it didn't work out. What's that, an ESI? What is being done there? It's an epidural steroid injection to the lumbar area of the spinal cord. The doctor, he's a neurosurgeon, did it twice, but unfortunately it didn't work. The doozy was on my birthday. We were in Rorschach on the seaside promenade, and there suddenly my legs failed. And lying on a bench, I had to wait for my wife picking me up with the car. After this, again, doctor, hospital. And then I got an infiltration right into the vertebrae. It was very painful, and even afterwards, nothing but pain. Then I had to... So, no solution there with painkillers. Right. And the doctor's statement was, if that doesn't help, then academic medicine is at its wit's end. There's nothing else for it but an operation, one on the neck and one in the loin. After that time, I had to take Tramal and Targin. These are pretty heavy opioid-based painkillers, and even that didn't help. The appointment was made for surgery. But then I wrote Mrs. Lackmann, actually not expecting I could receive a treatment that speedily. In between, I had an experience with a wheelchair. I needed help at an airport. I couldn't walk anymore, and that wasn't so funny. I believe you. Well, that was in Athens. And when we got back, the first appointment for Dao Yoga was right now. And Mrs. Lackmann told me and offered me a treatment right on Wednesday if I could make up my mind immediately. But I already had the appointment for the hospital. On Tuesday morning at 7, I went to my family doctor, told him I was doing something totally different. He shrugged his shoulders and said he didn't know I was responsible and... You are responsible for what I do. That's a good statement. Of course, you took responsibility for your own health into your own hands. Perfect. That's the way it has to be. The doctor was very open-minded. He is also a lecturer in family medicine, and he attended me all the time, even now. He was willing to go along with me, but wanted to have MRI pictures made from the spine as soon as the treatment is finished. So I had them made end of March. And I have pictures from before the academic normal surgery. And what was scheduled were basically 3 operations on the same subject. Arthrosis C5, C6, then L4, L5, and the arthrosis on the right. On the left I had already undergone surgery. Those were the 3 appointments. Mrs. Lackmann said that she can do 2 things together. Neck and loin, the thumb that doesn't go with it. She told me to wait with my thumb until the spinal treatment was completed. Because this is a bone problem, maybe the thumb will take over this kind of treatment. And that's what the pictures actually show, most clearly. The biggest change is in the thumb. That's huge. We can have a look afterwards. Okay, great. So you got the treatments right after the Dao Yoga seminar?
Dem Dao Yoga Seminar.
Yes.
Und das war dann wahrscheinlich der übliche Block
and that was probably the usual block of 10 treatments. Right. Was the result, independent of the X-ray image, also noticeable for you in matters of quality of life? Quickly noticeable? Did it take the 10 treatments? How did you experience it? The first 3 treatments were extremely painful. Well, I went to bed then. Once I really cried in pain. And I know some pain already. And then, well, approximately after the 6th or 7th treatment, I could walk in the park next to the practice for about 20 minutes again. That worked again. However, I was still hobbling, but at least I could walk again to some extent. That was practically impossible before. And actually, it all went pretty much the way as Mrs. Lackmann said. So, after the treatment, by the way, Nikolai did the treatment, not herself, and the rest was with her. And yes, she then said that there would be relapses, and there were. 2-3 times quite violently. Once at the town festival in St. Gallen, there was suddenly, I lost the feeling in my right leg again. And only being supported by my wife, I could manage the few meters to the car. Another time, we wanted to go out for a meal at the Wildkirchli. That's 5 minutes away from the train station, already too much for me, and went straight downhill. Yes, I had just such experiences. Then, during the further course of the treatment, there was the control at the end of October, the second Dao Yoga seminar. Mrs. Lackmann recommended me to do a liver cleansing because my liver couldn't quite keep up with the excretion of or reserving of tissue. I did that in my own practice in mid-November. Well, I could have done it with her in her place, but I got the things myself and did it, and it was also quite violent. Yes, and since then I don't have any remarkable restrictions anymore concerning the spine. And now I'm able to do practically everything again. Walk and run without pain as normal, running, walking, and I do a lot of gardening. Recently I also tiled the garden path. Things that were completely unthinkable before. I was just allowed to lift 3 to 5 kilos. These tiles were 10-12 kilos. And the side effect within the whole process was what happened with the thumb. That's resolved all by itself now. Yes, that's amazing. And you're doing more treatment with Nikolai now, aren't you? No, not really. That's finished. He did a treatment with me at the beginning of March, before I took the pictures. He also wanted to see with his hands a bit, but otherwise I'm not in treatment. I just do the Dao Yoga daily. And that's all. And you showed the pictures to your doctor. How did he comment on that? Or is that still pending? No, the doctor knows the pictures. We talked about it. It's like this. With the thumb, it's really great. With the spine, the pictures are somewhat blurry and difficult to read. But simply one sentence from the report. The nerve roots are no longer constricted, at least in the lumbar spine. Well, I noticed that myself. The sensory disturbances, they are not longer there. And also the sensory disturbances on the neck, the arms and hands. I had no feeling each and every night. That no longer occurs. And the pain is gone too. Pain is gone too. So you continue exercising Dao Yoga and get treatment if necessary again. Then I know where Nikolai lives. All right. We'll take a look at the pictures again, and then all that's left to say is knock on wood. Many thanks. What do we see here? So this is the X-ray after, and this is the one before. Exactly. And could you just tell me the difference and what has changed? First of all, Mrs. Lackmann told me she can't treat the thumb at the same time as the spine. So that was not treated, but she assumed the programming would cause the bones of the thumb to go along with it. And I am extraordinarily pleased that the bones have joined in. Of course, that's great. Here you can see the picture before the operation. The middle thumb here is so luxated it pokes out not halfway. The spongy tissue is arthrosis tissue. It's this one, right? Yes, but looks so spongy here. And that has now changed in 2 ways. The thumb is back in the socket. And the spongy tissue seems to have become a kind of thorn here. At the moment, it doesn't bother me. This means that the discomfort has subsided. I have no more restrictions on the thumb. Well,
Drastisch zu
you
sehen
can
ist
see
ja, wie
drastically how the
der
thumb
Daumen
here
hier, der hier richtig nach rechts
has literally derailed
gelaufen
to
ist,
the right.
quasi sich rausentwickelt hat, wie der jetzt
And
hier
now it's in line
wieder eine
here
Linie bildet
again.
und sich
And
wieder wirklich
yeah, it's plain to see that it
ähm,
has really regressed again.
zurückentwickelt hat.
Exactly.
Das ist in der Tat,
Indeed.
also
Even
selbst für
for
den Laien,
laymen,
wir sind ja
very
beide
distinctly
Laien,
visible.
gut sichtbar, gut sichtbar.
A gorgeous result for me, I have to say.
Und das, obwohl
And
es nicht
this,
behandelt
even
wurde,
though it
quasi
wasn't treated, it
als
evolved quasi
Nebenwirkung
as a
der
side effect of the
Wirbelsäulenbehandlung
spine
hat sich das
treatment.
so entwickelt.
Exactly.
Ja, genial.
It's the same subject here, osteoarthritis, and the bones join in.
Hervorragend.
Excellent.
Danke dir.
Thank you.
Spannend finde
What
ich ja
I
bei
find exciting
ihm
about
den
him is
Umstand,
the fact
dass
that the
die
treatment you
Behandlung, die du
did for the
gemacht
back
hast, im
area
Rückenbereich
also had an
auch
effect on the
Auswirkungen
hand.
gehabt hat auf die Hand.
Ja.
Well, that can happen. Neck area and cervical area influence our arms. And just by treating the cervical spine, you can also get a lot of improvement in the arms and the joints. If I treat an arm, for example, if someone has problems in his arms, I always treat the cervical spine because it influences this area.
Das sind ja mal
Well,
Nebenwirkungen
those
von einer
are side
Behandlung,
effects of a
die
treatment,
nicht nur nicht
which are
als
not only
Nebenwirkungen
without warning notice,
Warnhinweise,
but
sondern als einen
greatly
tollen
positive side
Nebeneffekt
effects.
zu betrachten wären und zu betrachten sind.
Yes, it often happens that something in the body improves elsewhere. Important is, this method has no bad side effects. Something bad can't happen there, only positive reactions.
Du hast gesagt,
You pointed out earlier that the whole thing is also visible and measurable. Now, we have looked at these X-rays, and even for a layman like me, it's quite clear that the positioning of this thumb, with real arthrosis and real movement problems, has visibly returned to normal range after the back treatment.
Sichtbar wieder in den Normbereich gekommen ist.
Yes, you can see that. With the X-rays and other examinations, not everyone can interpret the pictures. But this is a good example because anyone can perceive that. Right. It is especially important because it also becomes clear that reprogramming the consciousness on the level of consciousness quite obviously has an effect on the physical level. So it is not only the case that I subjectively have the feeling in my head that back pain is gone, but I also see the change in the X-ray image on the normal and coarse material level. Yes, it's not just information in the subconscious. It's directly related to the problem. You can see it, sense it, feel it, everything. You can control that. I mean, you've got a patient here who should have had 2 operations on his back and hand. So 3 operations were on the agenda here. I would always be interested to know how the attending academic doctor reacts, who asserts that surgery had to be done here and there, and half a year later he sees such pictures. I mean, how can such a poor doctor cope with the fact that suddenly everything has changed as if by magic, without surgery, without medication, without pain, without all the risks associated with surgery? Well, from my experience, I have to say that many doctors do not understand. So far, we have only had the reaction, I don't understand it, I don't know how it can happen. You practice paranormal surgery here in Switzerland, right here in Zurich. We are here in Zurich. Are there differences between the various cantons in terms of official acceptance? Has it been difficult here in Zurich to get something like an admission, a work permit for your work? Well, in Zurich it wasn't that difficult, because here, for example, you can practice without training as a non-medical practitioner. That's not the case in every canton. In St. Gallen, for example, I think it's not like that. Zurich is simply more open. Zurich is more open. Canton Zurich is more open. Inasmuch, if people have health problems, then it's probably the easiest thing to come here. The seminars you give, you do them both here and in Germany. Yes, meanwhile I do them in both countries. If you have now done such 10 treatments of paranormal surgery, do you always advise patients to continue by supplementing it with Dao Yoga? Are the patients sent home with the proviso that they absolutely must continue doing Dao Yoga? Yes, that's very important. If you want to get a result like Herbert's, then you have to keep on doing Dao Yoga. First of all, of course, be patient. Because after the 10 appointments, the treatment goes on and on by itself. And during this time, it may be that disorders come up again, then go down again, then up and down again. And at some point, they stay away. But you have to go through this time continuing Dao Yoga. Why do the disorders come up again? Because the information has been exchanged, and every now and then an old piece of information simply comes up again, as long as it has not yet been exchanged on 100%. And, of course, you live as a human being here in the Western world, in an environment of friends, family, or work colleagues, which is possibly rather hostile to such methods. And then, of course, doubt and skepticism can suddenly soak back into consciousness. And then, of course, you have the old problems again. That's why it's very important to think positively during and after the treatment. That makes a lot of things easier. Because if you think negatively, you can influence yourself or feel worse. If you think positively, as soon as the pain comes back a bit or a lot, just think in this time where the treatment is going on, that's not bad now, it doesn't mean that everything is the same like before. 90% of the people don't understand that right away. Many become desperate, they call me, but then I calm them down and tell them, this is just the treatment, you will see. After a few days they feel better again. That often happens. With all of them. Many have questions, many are afraid, but you don't have to. Are there any medical problems or medical situations where you also recommend a second round? Where you say you have done 10 treatments with paranormal surgery and after a certain period of time another 10 would be good? Or is 10 always the number and that's it and that's all I need? Well, it rarely happens that you have to do a second round, even very rarely. If someone has much too strong ailments, much too strong, you sometimes have to do a second round. In multiple sclerosis, however, you have to do several rounds, not just 2. There, for example, the treatment runs for 2 years, and every 6 months you have to go through 10 treatments. But usually 10 is enough for other health problems. Okay, understood. MS is of course something very different, to be clear. And one can well imagine that you have to enhance the reprogramming once again. Yes, in this case you have to do more work, exactly like with Parkinson's syndrome. These are extraordinary difficult cases. That's why it takes 2 years, just like with multiple sclerosis. Last question with Herbert. Did you work here also with massage, since you mostly combine that, or didn't you need that? I also worked with him with massage. As a rule, spinal disorders also bring with them a lot of tension. For example, a person tries to compensate on one side to lower the pain, and then this side is very tense, what causes additional pain. That's why I do massage. Not always, but often. Is that a combination of paranormal surgery and Tibetan massage, or is that something completely separate? so that you do paranormal surgery and then 14 days later massages? Or how do we fancy that? Well, that's a combination. I do massage first, then I do paranormal surgery, and in the end I do additional energy treatment. Everything in one day. And this is a cycle of 10, all 10 times in a row. Yes, then we wish you much success with this combination. Your specialty are 3 pillars, namely teaching Dao Yoga, Tibetan massage, and paranormal surgery. And we saw your patient, Herbert, how he can walk around and how he can move, and his testimony. What a difference, like day and night, before and after. And all of this without blood, without surgery, but completely paranormal. Thank you very much. Dear spectators, we fade in the website of Nikolai Lackmann. There you can find further information and, of course, contact details, seminar dates for a Dao Yoga seminar, and, of course, the possibility to contact him directly in order to arrange massage or paranormal surgery treatment with him. As always, a huge thank you for taking interest and your attention. So long and goodbye.